So I'm pleased to welcome Maureen Gustafson today with us. She's one of the winners of the Knowledge Translation Student Award, which is awarded by the National Collaborating Center for Public Health. I just want to start by saying a big congratulations, Maureen, on winning this award. It's really fantastic, and we really look forward to hearing your presentation. And with that, I'll pass it over to you to present on your award-winning project.
Awesome. Thanks so much, Claire. And as Claire mentioned, my name is Maureen. Just to kind of self-situate, I'm an Ojibwe woman from Couchiching First Nations. I have mixed Ojibwe and European settler roots. I say this to acknowledge all of my ancestors and honor every part of me, but also to acknowledge my privilege as someone who has light skin. I think that's really important to kind of acknowledge right off the bat. And just to kind of continue with that in terms of self-situating, I'd also like to acknowledge I'm from the Treaty 3 territory, which is pictured in the top left corner of the screen. At the time of this work, I was a student in Toronto, which is located on the traditional territory of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit River, and is now home to people of many nations from across Turtle Island, which we sometimes refer to now as North America. For my practicum, I traveled to Canberra, which is the capital of Australia, and in Australia, they often refer to traditional owners when acknowledging land or country. So the traditional owners in Canberra are the Ngunnawal people. And finally, during my practicum, I was lucky enough to travel to far north Queensland, which is pictured in the bottom right, where I worked on Gunganji, Yuraganji, and Yidinji land. And I started with this because as an Indigenous woman, it's really important for me to position myself in relation to the people and also the lands that I work on and with. And I'm really grateful and lucky to have been welcomed so warmly by Indigenous folks from different areas. So just to give you a bit of an outline here, we'll start with an overview of the study and the project that I worked on, talk about some background stuff in terms of knowledge translation, delve into the details of how we developed the framework and what it ended up looking like, and then some kind of reflections. So I was lucky enough to be a part of a study called the Mayi Kuwayu study during my time in Australia, which is a national study of Aboriginal and Torres Strait Islander well-being. It's a large-scale longitudinal cohort study, and the data is collected using surveys and linked to administrative health records. Recruitment happens in a number of ways, so you can complete the survey online. They are mailing some copies out. They also do some recruitment in person at community-based events where people can fill out the survey at stalls. And they also have very extensive community partnerships through which to promote the survey. The survey asks about items like socio-demographic factors, cultural practice, health and well-being, different life experiences and environments, and family support. And I mean, the significance goes beyond what I can really touch on here, but you know, it's Indigenous-led. It responds to needs that have been identified by communities, and it can serve as a policy and program planning resource down the road, all of which are really important and amazing things. So in terms of my practicum, the office was in Canberra. My work was based mostly in Yarrabah, which is in far north Queensland, as you can see on the map. Going back to the idea of community partnerships, a really strong relationship exists between the research team and the Yarrabah Leaders Forum, which I'll refer to from now on as the YLF, which is a group of different folks representing health and social services organizations in the community. So these two parties have adapted the survey to meet the needs of the community. So they've added questions and developed a really comprehensive recruitment plan to hopefully get a highly representative sample of respondents from across the community, which is slightly different than what MK is doing on a national level. And not only will this enhance recruitment, it will perhaps more importantly, I would argue, produce results that will inform the Yarrabah Social Impact Investment Initiative, which is an incredible 6-pillar community development initiative that the YLF has put together. So after learning more about the really awesome work that they're doing, my guiding question was, how can we share results in a way that supports the YLF's work and objectives? And this is, sorry, an image of the Yarrabah Social Impact Investment Initiative pillar visualization. And as you can see there, they touch on a number of different areas in their plan, which is really exciting. So yeah, our goal is to kind of help translate results in a way that's going to help the community, because I think that's what knowledge translation is all about, right? So the standard definition that we hear is that it's the process of strategically putting research findings into action in order to improve health systems, policies, and programs. I think that's the standard CIHR definition. And to me, that's just kind of saying we want to make sure that research is making a difference in people's lives, because what's the point of doing research if that's not going to happen, right? I also wanted to highlight, though, that some First Nations scholars have put together another definition, and that's kind of sharing what we know about living a good life. And this acknowledges that Indigenous people have always practiced our own forms of knowledge translation in order to promote well-being amongst communities. And, you know, if you do some reading on Indigenous views on knowledge translation, there are some elders and knowledge keepers that even say, like, what is this concept of knowledge translation? Because to them, it's so inherent, it doesn't even really have to be acknowledged. They can't imagine a world or a context where they have knowledge and don't share it, right? So I think that it's really important to keep this in mind, especially in the context of the work I'm talking about, but more broadly as well. So everyone here probably knows about the different kind of forms of knowledge translation, but I'll touch on them briefly just in case they don't. So there are 2 broad approaches to knowledge translation. So the first is end of grant, which is waiting until your study is over to disseminate results and make people aware. This is not bad in and of itself, but it can be a missed opportunity if you're not engaging intended knowledge users until the end. The intended knowledge users being whoever is going to make use of the data. On the flip side, you have integrated knowledge translation, which is really about meaningfully engaging with your intended knowledge users to shape research throughout the life of the study. So from conceptualization onwards, like literally at every step, right? This generally produces research that is more likely to be applied because the people using it are telling you what they need, which makes sense. And because you're hypothetically engaging stakeholders as equal partners, or you should be anyways. And this aligns really well with ethical principles for research with Indigenous communities, which we'll touch more on later. So for the MK study, the investigators took an IKT approach. It also involved the translation of quantitative data, and this kind of involves unique challenges and considerations as well. So we know that the vast majority of the general population does not have the quantitative literacy skills to accurately comprehend statistical outputs. So even people who have a post-secondary level education, if you're not trained in stats, it's really hard sometimes to understand the nuances of stats, right? Researchers often also fail to present statistical information in a way that's engaging and meaningful, as I'm sure lots of us know from personal experience. So important to think about these pieces. And in order to address these challenges, some researchers by the name of Nelson, Hesse, and Croyle have created this process called the opt-in process, which is supposed to be kind of a guide for helping to translate quantitative health data. And I've included the reference in the bottom of the slide and at the end of the presentation in case anyone wants to check this out. So basically, you can use this process to help communicate findings to lay audiences, so anyone without a stats background. And opt-in stands for 4 different stages. So the first is organize. So you're going to start by organizing the info, which means basically familiarizing yourself with the methods and the limitations of your data and considering how it aligns with existing scientific knowledge, and kind of deciding what story you want to tell with your data. The second stage is planning, which involves determining what objectives you have in terms of knowledge translation and gathering information about your audiences, which you can use to help design some knowledge translation products. The third phase is testing, which I think is very self-explanatory, and the last phase is integrating. So that's kind of providing recommendations and further resources, and also integrating the materials across channels and across time so that you have a consistent message. So for the organization phase, the MK team, when I was a student there last summer, had already conducted literature reviews around some of their research topics and assessed the state of the scientific knowledge. Because they hadn't actually collected the data yet, we weren't able to look at the limitations of the data and decide what story we wanted to tell. So we jumped ahead to the second stage, which is planning. So this is kind of how we worked with the community, or the context of how we worked with them to develop a community level KT framework. And this was a part of, again, the commitment to providing MK data to organizations and community in a way that is really accessible and meaningful. And I guess we'll kind of go through some more about the progress on that here. So when we're in the planning phase and we're thinking about our objectives, we're essentially establishing what we want to achieve by communicating the data that we're looking at. So we did this in collaboration with the YLF. We had a bit of a workshop where we really explained the opt-in process and what we were hoping to do with it, and did some experiential learning to help understand some of the nuances of translating data. And I think this provided us with a really good foundation to build on. So we started with some very generic examples of possible KT objectives and asked if these resonated. People started to talk about them and potentially, suggest potential edits or ways to tailor them. And once they were more comfortable, they started coming up with some original objectives on their own. And this was a 2-day process, so we did allow things to kind of sit overnight, and we revisited the next day, which I think was great. And this was the final list that we came up with. I won't read them all, but they're up there on the slide. And again, they really reflect the unique context of the work that the YLF is doing in Yarrabah, which I think is really important. We also found that there were specific themes that kept coming up that weren't necessarily measurable objectives. They were more like principles that should underlie all of the KT work that we were going to be doing. So we decided to incorporate these as separate guiding principles, as you can see on the slide. This is not part of the opt-in process. This was one thing, we decided to deviate on, but we thought that it was really important, again, just given the unique kind of context of doing research with Indigenous communities and how important it is to incorporate principles like reciprocity, as you see there, and strength-based framing, trauma-informed communication, things like that, right? And it was clearly really important to the community too. So that was really awesome. The next stage is about determining your audiences. And in KT speak, this is what I was referring to earlier as intended knowledge users. So who is going to be looking at the data that you're translating? So we looked at the objectives, they're all mapped out there, and tried to flesh out, who do we need to share this data with in order to reach these goals? And a number of different audiences came out here. Some of them are to be determined. Like I said, data collection has not finished yet, not even the first round, I guess, let alone subsequent rounds. So some of these will come out in time, but some of these we were able to pinpoint right away. And this is a list without the repeats, kind of cleaned up a little bit. So we knew I wouldn't have time to complete audience analyses for all 6 of these groups during my practicum. Time was very limited, so we picked 2 and kind of did a trial with those. And the 2 we picked were policymakers, because the objective around influencing policy applies to the entire MK study. We also picked the YLF as well, because we had already established relationships with members of this group, so it just kind of made sense. So in terms of analyzing audiences, this step is about accessing relevant information about a specific audience to help you tailor your knowledge products. So the types of questions that you'll ask to do the analysis will vary depending on the audience you're looking at. We use the ones that are listed on the slides, and they came from the sources listed below. You can kind of seek the information to answer these questions in different ways, again, depending on the context. So for major like health communications or public health campaigns, you might go pretty big and do a big survey or focus groups. This was a bit different, right, at the community level. We had hoped to do some in-depth interviews with members of these groups, but unfortunately, we didn't get ethics approval on time. So instead, we took a more informal approach, did some informal kind of chatting with some members of our team who had some experience in policy and community-based work. So the product of this stage was this chart. And I apologize. I guess it's really hard to see. There was a lot of writing, so hard to get a screenshot with all the columns that still had enough detail. But essentially, you know, in the first row, you might be able to see there, we were identifying who was included in the audience, and it was important to be as specific as possible. So if you look, when we're talking about policymakers, you have kind of politicians that are elected and also bureaucrats. So the politician that we were kind of hoping to target was the Minister for Indigenous Australians. Bureaucrats, you have some other folks. When we see community leaders, we have people from the Arab Leaders Forum in there. So again, it was just trying to be specific as possible. We kind of tried to figure out, you know, for example, what background do these specific people have in statistics? So some of them had graduate level training in statistics, some of them did not. So there's a big mix there, and that was something that was really important to think about. Thinking about how they could use the information in their roles, what kind of influence they had, all sorts of different things, right? And that really, again, just gives us the idea to, gives us the information to really tailor what we're putting out to the specific audience in order to make sure that we're achieving the objectives that we set out, right? So the third step is really applying what you've learned from steps 1 and 2 to design some knowledge products. And that provides you with a really good foundation to then go through the subsequent steps and test and integrate the knowledge products in line with the opt-in process that I described earlier. And during this, like when you are developing some knowledge products, there's also lots of information in the opt-in process about the application of design principles in social math to help kind of visually present the data in a very efficient and good way, but also how to use different framing techniques to help present the statistics in a way that is meaningful to people. So that was our preliminary framework. Again, we're still in data collection phase, so we're going to have to wait until that's done to kind of apply that. But for now, we can, I think, generate some really useful discussion and reflect on this process so that we might be able to apply it again in the future with other communities that are involved in the MK study. So we did get really positive feedback from the YLF regarding the process that we went to with like the workshop and going through the opt-in stuff. So they were really enthusiastic. They were thinking about how they could use the data to benefit their community. They also shared that, you know, sometimes they struggled with making the most of the data that they had, whether it was data they collected themselves or data that they were given by government agencies and stuff. So they did see the opt-in process as being somewhat helpful and something that they might actually be able to use in their own work eventually, which was really awesome. And again, ties into that idea of reciprocity, right? Also noting, I guess, that this was really possible because of the existing relationships that had been cultivated between the community and the research team. And I think that's really important to acknowledge, right? Because often when we're doing research, we have these really tight deadlines and these ideas of when things will happen and how quickly things need to move. But I think, again, especially in Indigenous contexts, but also in other contexts as well, it's really important to cultivate meaningful relationships, and that takes a lot of time, right? So yeah, an important reflection there. We also had to changed the way that the opt-in process worked for us, as you heard me mention earlier in the presentation and some of the different slides, right? So for example, the opt-in process, the way it's originally designed, is very linear. It's kind of a step-by-step approach, or that's how it's presented anyways. Whereas the way that we used it had to be very cyclical and iterative, in line with an IKT approach. So again, we started with organize, they had done a lit review, then we had to jump to plan. And then once the data is collected, they'll go back to organize and go through all the phases, right? Again, tying to that, I think the opt-in process was generally designed for more of an end-of-grant approach versus an IKT approach. It was also, the original, I guess, was very objective-driven, and of course ours is objective-driven too, but also very value-driven, as we discussed earlier. That was a departure from the original process that was really important to make. And the original also really positions researchers as the sole decision makers in this process. Like when you go through the book, it talks a lot just about the researchers making decisions, and that's fine. But in this case, it was actually really important that, that it was a shared kind of process and responsibility. The decisions were really made in collaboration with the community, just in line with the context, right? So all of this was really necessary to accommodate an IKT approach, Indigenous ways of knowing, doing, and being that really favor the cyclical, iterative stuff rather than a linear step-by-step approach, and to be in line again with ethical principles for research with Indigenous communities, because we do know that there's a history of some really unethical research that's been conducted. Often it hasn't been reciprocal. Often there was actually harm that was done to Indigenous communities who participated in research. Informed consent was not always followed. And some of those things remain true to this day, unfortunately, both in Indigenous communities in Australia and here in so-called Canada, right? So really, really important conversations to keep having, I think. So I guess that's an explanation of the project. For me, I also wanted to give some acknowledgements before we end. So really, really want to thank members of the YLF for welcoming me so warmly to their community, for trusting me, and for sharing all of their knowledge with me. Also wanted to thank my supervisors for their support and guidance, as well as members of the Mayi Kuwayu research team, and also some folks at the Wellbeing House back here in Canada. And finally, just wanted to thank the Office of Global Public Health Education and Training for supporting me financially to be able to go all the way to Australia. So with that, I think I will hand it over to Claire to see if there are any questions.
Great. Thank you so much, Maureen. That was a really fantastic presentation. I really enjoyed learning about that work. So one of my first questions is, what are you doing now, and where did your graduate studies lead you?
That's a really good question. Yeah. So I've been reflecting a lot on this lately. It's been almost a year since I came back from Australia, and I'm currently working as a health promotion planner at the Thunder Bay District Health Unit, which is really exciting. This role, I guess, has involved a lot of health communications work, especially in the context of COVID-19, as everyone knows, I'm sure. So, I think the skills that I learned in knowledge translation during this practicum, even though it's not necessarily that we're translating studies that we conducted ourselves, we're still communicating health-related information in order to kind of help the general public understand some of the nuances around COVID and how to keep themselves safe. So yeah, I think that the work that we all did in my time in Australia was really, really useful in that sense, and provided me with some really transferable skills, which is awesome.
That sounds really neat. And my second question is, what inspired you to learn about knowledge translation? And I guess, why did you want to do this practicum, or why did you want to use knowledge translation in the project?
That's a great question as well. So my first practicum was at the Wellbeing House, which is an action-based research center for Indigenous health at St. Michael's Hospital in Toronto. And Dr. Janet Smiley there, who was one of my supervisors for this project as well, talks a lot about knowledge translation in Indigenous context. So she really introduced me to that world and how important it is. And I was also lucky enough to be a part of a team at Public Health Ontario during my graduate studies, where I worked on some knowledge translation stuff for the Indigenous Dream of the Healthy Kids Community Challenge. And the folks there taught me so much about knowledge translation as well. So a big shout out to all of them. And when I started trying to figure out what this practicum in Australia was going to look like, my supervisor was asking me, okay, well, what are you trained in? What skills do you have? And I was trying to think on the top of my feet and was like, well, I do have some skills in knowledge translation. And he was like, wow, that's great, because that's something we really need. So I think it was just a really organic fit. And, it kind of allowed me to build on the skills that I had developed, but it also helped me to, helped the team to kind of fill some gaps that they had in terms of, I guess they had the knowledge, maybe not the time, but yeah, it was very mutually beneficial in that sense. So yeah, that's kind of how it all came about, and it really worked out quite well, I think.
That's great. Thank you. And I just have one more question. So, of course, recognizing the importance of setting and context, I was wondering if there's any kind of key takeaways or messages that you think from this project that could be applied here in Canada.
Yeah, that's another really great question. So I think in terms of like bigger picture stuff, I talked a little bit throughout the presentation about how research in Indigenous communities, or rather with Indigenous communities, there's a unique context that we have to keep in mind. So there are some really, really, really vital ethical principles that are important to follow. And in general, the approach is very different, right? And that the idea of reciprocity is so, so big. So, researchers are gaining a lot in the work that they do. You're really building your career off all of this, and what are participants getting in return? And I guess not even just what are participants getting, but what is the community getting in return, like on a kind of collective level, because again, in the past, it hasn't always been mutually beneficial, right? In some cases, it's been harmful. So I think that obviously, again, that's relevant both in Australia, in so-called Canada, and in other countries where colonization has kind of had similar effects. But it could also be relevant to researchers who are working with non-Indigenous populations too, because that idea of reciprocity can extend beyond that context. So I would just really say, knowledge translation is one really, really important way of ensuring that you can embed reciprocity into your work. Of course, there would be other ways as well, but given the context of this presentation, I guess it's a really important one to plug, right? So yeah, just seeing that process, not as something you have to do because the CIHR or whoever tells you to do, but because it really allows you to give back and to make sure that the relationship between yourself and whoever you're working with is a reciprocal one.
Great. Thank you so much. That was such an insightful comment. I also really wanted to highlight again what you said earlier, and you had also put it, I believe, in your bio, which is on the NCCMT website, which I thought was a really great point, which is about how important knowledge translation, but that it isn't a new concept. So I just wanted to highlight that again.
For sure. Thank you.
Is there anything else you'd like to share, Maureen, or any last words about your work?
Nothing new. I think just big thanks to you guys for having me, and to, again, the YLF in kind of allowing me to be a part of this work, because it really wouldn't have happened without them, as well as my supervisors. So just want to express my gratitude to everyone who was involved.
Great. Thank you so much. And a big congratulations again. And thank you so much for sharing your work with us.